Welcome back. In November, healthcare professionals nationwide are working hard to raise awareness about diabetes. Diabetes is a chronic illness that affects millions of Americans, and according to a recent study, by 2050, approximately 1.3 billion people worldwide will have diabetes. Dr. Hanna Lee, an endocrinologist at Montefiore Health System, joins me to discuss their efforts to raise awareness about this condition. Doctor, thank you so much for joining me.
Hi, thank you.
Now, millions of Americans are affected by either type 1 or type 2 diabetes. Can you explain how this illness continues to affect the lives of so many people?
Diabetes affects the lives of many people because it's a chronic or a lifelong disease. And so people have to adapt their lifestyle to this disease. It also has an incredibly high prevalence rate. So currently in the US, 1 out of every 10 people have diabetes. 1 out of 3 people have prediabetes, which is a major risk factor for diabetes. And unfortunately, diabetes carries along with it many complications. It's a leading cause of cardiovascular disease, heart attacks, strokes, leading cause of blindness, amputations, chronic kidney disease. And so that's how it affects millions of people.
Now, what are the risk factors that increase the likelihood of developing diabetes?
The risk factors for diabetes stem, and we're talking about primarily type 2 diabetes, has a lot to do with lifestyle. So, decreased physical activity, increased intake of high caloric foods, high fat, high sugar foods. Those two can lead to increased rates of overweight and obesity. Those are major risk factors for diabetes.
Now, another risk factor that I kind of want to talk about, which is I think is really important, is social determinants. I know that a lot of people don't necessarily think of it as one automatically, when they hear that, but can you expand on that and how that is a risk factor?
Social determinants of health are conditions in our environment in which we are born into, in which we work, learn, play, essentially where we live. And these conditions affect our functional status, our quality of life, and our health. And so some examples of social determinants of health include access to education, quality of education, access to health, quality of health, social and economic status, affordability of food and healthcare. Also includes things like racism, discrimination. And so all of these factors, if one is negatively affected by them, are at risk of developing diabetes and have a higher rate of developing diabetes and its complications.
And when I first saw this, I thought it was so interesting. Is this a newer, just like revelation, like oh, social determinants can affect your health in this way, or is this something that has been a part of the healthcare system that people have known for years?
There is growing research in this area, and I think that's why there's a growing awareness, but it's not enough. And this is why programs like this are so invaluable because we do need to raise awareness about how these kinds of inequities, systemic inequities, do drive, are contributing to the increase in diabetes.
Now, I also want to talk about the Bronx. We talk about on the show a lot how the Bronx, unfortunately, in regards to health is, number 62 in a lot of things. Can you just talk about how diabetes, type 1 or type 2 is affecting members of this community?
So the Bronx is clearly affected by diabetes. The prevalence rate is actually the highest in all of New York State, up to 16%. And that's almost double compared to other counties in New York State. And so clearly, we have a lot of communities, areas that are also affected by social determinants of health, like hot pockets of poverty or communities that are composed of immigrant populations or groups of historically marginalized communities. And so I think those are kind of just a few of the factors that are driving the high prevalence rate in the Bronx.
Now, what are the signs and symptoms of diabetes?
So some of the signs and symptoms of diabetes are increased urination, increased thirst, which leads to weight loss, but unhealthy weight loss. Also can lead to just feeling generally unwell, tired all the time. But what's more common is diabetes is often silent. There are no symptoms. And so it's a silent disease. And so that's why it's even more dangerous and requires a lot more awareness.
Now, according to a recent study, and this is like pretty shocking, around 1.3 billion people worldwide will have diabetes by 2050. Can you tell me a little bit more about that study and just how we came to this point?
I think you might be referring to a paper that Dr. Shivani Agarwal from Albert Einstein College of Medicine just recently published. And so that paper actually quoted that number of 1.3 billion, which is a shocking number. That paper that Dr. Agarwal published was more of a narrative overview of how a lot of these social determinants of health are driven by structural inequities, structural racism, are driven by global inequities, and how we need to actually acknowledge this in order to put a break in this rapid trajectory of diabetes and how it's a growing epidemic.
Now, I think this is also really interesting. As you mentioned, the study highlights structural inequities and racism as a contributing factor. And, oftentimes we think of like it in our country, but, I'm curious to know how is this affecting, people from across the globe?
So globally, diabetes is a growing epidemic. You just mentioned 1.3 billion people in the world will be affected by diabetes by 2050, which is 27 years away. And when we look at countries who are primarily of lower income countries or middle income countries, they have a much higher prevalence rate and they have less of an ability to adequately manage, treat diabetes and prevent complications from diabetes. And this is compared to higher income countries. And with these lower income, middle income countries, it's probably also driven by lack of funding to healthcare, lack of access to healthy foods, just not having the finances or the human resources to handle this.
Now, as time goes on and as we, get closer and closer to the future and it becomes the present, we hope that these issues would, somehow be mitigated. But unfortunately, the number is still increasing. Can you just explain, as somebody who works in the healthcare field, why you think this number is continuing to increase instead of decrease?
I think the numbers are increasing because there's been a shift in behaviors and a shift in our food supply system. So our lifestyle is much more sedentary than before. We move by transportation. We have different kinds of work styles that don't require a lot of physical activity. In addition to that, though, is we have much more easier access, and cheaper foods are of higher caloric content, high fat content, high sugar content, ultra processed foods. And again, both of these, I think, are leading to increased rates of obesity and overweight, which are major drivers to diabetes and type 2 diabetes.
Now, according to the CDC, and you mentioned this yourself, people who have less access to education are more likely to be diagnosed with diabetes. How are Montefiore specialists educating the community on diabetes?
So Montefiore is taking this very seriously, and November is National Diabetes Month. And so we have coordinated over 30 events where we're trying to reach out to our local community through educational events, through screening events, for instance, where we're trying to really just bring awareness to really kind of send this alert message that you can check if you have diabetes. And if you do, you can work on it and it can be prevented, and that these long-term complications can also be controlled.
Now, one of the reoccurring events Montefiore hosts is Eat Well and Track Your Food to Prevent Type 2 Diabetes. Why is this a class you want to ensure community members have access to? And what can people expect when they attend these classes?
So that's just one of the many events we have scheduled. And that event is really focused on making sure that we have healthy dietary lifestyles. Again, a major driver for type 2 diabetes, which is the most prevalent type of diabetes, is really making sure that we make the right decisions on what kind of foods we're eating. And so if you go to that event, you'll learn more about choosing healthier, complex carbohydrate foods, foods that are rich in fiber and lower in sugar, simple sugars, and fat and cholesterol, etc. And I think those can make an impact in people's lives.
Now, one thing I also want to touch on is the cost of living with diabetes. We recently had a show where we talked about this. Can you just, speak on how that impacts individuals who have the illness, especially, coming from maybe lower income areas?
The cost of living for someone who has diabetes is quite high. And the reason why is because it takes time, energy, and it takes money to make sure that you can afford the medications, see your doctors, get tested, access those healthier foods. And a recent study from the American Diabetes Association just came out showing that 1 in every 4 US healthcare dollars is because of diabetes. And so that just kind of shows you the magnitude of how high the cost of living is for individuals with diabetes.
Now, what are some preventative measures that could be taken? I know it's hard, especially since we talked about social determinants, but what can people do to kind of take charge of their health?
So I think the first thing that can be done is to get tested. Ask your doctor, speak to your doctor, ask questions about diabetes. And if you do have a diagnosis or want to learn about prevention, I think implementing those changes, becoming more active, being more physically active, exercising, and again, avoiding kind of sugary foods, sugary sweetened drinks. Those are just a few ways to kind of get this under control.
And what do you hope to see for the future as somebody who works in healthcare? As I mentioned previously, unfortunately, things are starting to rise. But like, what do you hope to see for the future, of diabetes and how we as a society mention and talk about diabetes?
So diabetes may carry a stigma. And I think by acknowledging how there are these iniquities embedded in our culture, in our society, that stigma really needs to be reduced and removed. And just acknowledging and being aware that diabetes is a disease, but it can be controlled is a major message to get out there.
Thank you. And I'm so glad that you mentioned the stigma. I didn't get a chance to talk about that, but I think it's so important that we try to destigmatize a lot of the, just a lot of the health, situations or illnesses that are out there. So I appreciate you so much for, saying that. Where can people go or how can people learn more about diabetes?
So it can be through your doctor, your healthcare providers. At Montefiore, we have, again, a month long of events scheduled, but even throughout the year, we have pre-diabetes courses, type 2 diabetes courses that are available. And for this month, we have a website at montefiore.org/diabetes-month, at which you can definitely see what we have available for all these events that we have planned.
Well, doctor, I want to thank you so much for joining me.
All right. Thank you again for inviting me.
To keep up with all the work and the efforts of the Montefiore team for diabetes education, please go to their website below at www.montefiore.org/diabetes month. Stay tuned. We have more open for you right after this.